Hi, my name is Jody Anderson, and I am recording this video for NU665, and it is about my pocket guidebook that I have created this semester so that I have quick reference to information that I have learned in each week. And so what I have done, which I found works really well for me, is put it on my phone. So in my Google Docs app, I create different notes for each week and with different information. So on my phone here I have my Google Docs app, and it might be kind of hard to see, but I have different weeks of information. And so as I go through that information, I type it up on my phone, and it's been really helpful in clinic because I can just open it up on my phone and look something up if I have a question, and it's really just easily accessible. And when I'm using my laptop, I can just pull it up on my phone too, for homework purposes and things like that. And I think it will help me as I go on to be a WHNP so that I have this information just still available on my phone. And because I always have my phone with me, so I just figured that was the easiest way to do it. So I have, for instance, acne vulgaris, and I took down all the notes, and basically I tried to get all the most important information for each week. So like for acne, risk factors, clinical presentation, pathogenesis, and classifications based on morphology, treatment types, what are the best options for treatment, and then common side effects for treatment, and patient education, oral antibiotics, different types, and how the acne is classified according to severity, mild, moderate, or severe, and treatment. And then also at the bottom there I have acne rosacea. And so that's good information. I did a week here on migraines and headaches. And so I put in all the cranial nerves and whether they're sensory or motor nerves, and I listed that to begin with. And then primary headaches and what are the causes, migraines without aura, and risk factors, how to diagnose that, and then maybe I can see that better. Secondary headaches and causes, tension headaches, cluster headaches, and signs and symptoms of those, and then treatments for each of those. And we have a family history of migraines/headaches, and so this was really good information for me to have available. Another week, anxiety and depression. How the general anxiety disorder is classified, the DSM-5 criteria, symptoms of it, benzodiazepines, and risk factors when you're using benzos, patient education, Mr. Fisk, how to remember, the assessment scale for that, subjective exam, diagnostic tests, things like TSH, CBC, blood sugar, that you can check also when someone says they have anxiety or depression, and treatments, SSRIs, SNRIs, and then for antidepressants, first line treatments, and then into depression, and also the diagnostic criteria for that. What happens to people when they have depression? They lose interest in several factors: sleep, guilt, energy is low, concentration, the PHQ-2 questionnaire that is used, subjective information, differential diagnoses for depression, medical diagnoses for depression, medications that might cause depression, labs to be done, same as anxiety, treatment. I keep moving that out of the screen. Treatment and patient education so that they know what is important to know when taking an antidepressant. Okay, so the next one would be osteoporosis. risk factors for osteoporosis. I felt this was important to add into my phone because the T-scores, I wanted to make sure I memorized those and got those right. Risk factors, medications that can cause osteoporosis, screening recommendations, body mass density and DEXA scan that is recommended, the classification system, the T-scoring, when to consider treatment for osteoporosis. The FRAX risk assessment is on there also. Different types of treatment for women, recommendations on calcium, vitamin D, medications for osteoporosis versus osteopenia, anti-resorptive, anabolic, alendronate, abandronate or sendronate, zoledronic acid, and then raloxifene is on there, and excuse me, patient information, Prolia, so teaching regarding side effects or how long they should take the medication and things like that is listed in there. Another one that I have several in here, but I added in hepatitis and hepatitis A. I went through each hepatitis A, B, risk factors, vaccinations, the hepatitis B labs. So I'd have those accessible on my phone because I found those a little bit tricky to memorize. A, B, let's see, and hepatitis C and hepatitis D on here. Common treatments for hepatitis B and just a medication for hepatitis C. So that was my hepatitis one. I have vulvodynia, I have vaginitis, endometrial hyperplasia. I did that one on here, and the endometrial stripe thickness. I wanted to have that on my phone so that I can reference that at any time, because it breaks down to the menstrual phase, follicular phase, luteal phase, ischemic phase. Endometrial stripe less than 11 millimeters is low risk for cancer, so good information, because endometrial biopsies are fairly common, it seems like. Hyperplasia without atypia, endometrial intraepithelial neoplasia, information on what that is, risk factors, findings, subjective, objective, diagnosis, and management on there, based on their age and risk factors, treatment, endometrial cancer. You can see that, causes, risk factors, symptoms of endometrial cancer, PAP findings, physical exam and diagnostic workup, adjuvant treatment, and then I went down into uterine sarcoma and listed risk factors for that, signs and symptoms, what you usually find on a physical exam on that one. Another one I have here, vulvovaginal atrophy, vaginismus, primary, secondary causes, subjective. This is really good because I am doing a rotation in Urogyne, so this is really beneficial to me. Exam, treatment, and also I have a lot of fibromyalgia. I listed cause, what it is, what symptoms they exhibit, diagnosis. There's not really any labs, where tender points in fibromyalgia to remember where people are most tender, treatment for fibromyalgia, and then osteoarthritis, and also how that is exhibited, risk factors, symptoms. Oh, whoops, I didn't mean to close that. Diagnosis, mild, moderate arthritis, and rheumatoid arthritis. Risk factor, symptoms, diagnosis, labs, x-ray, progressive signs, and treatment. I listed that on there. And different kinds of medications and patient education on that kind of thing too. So, all right, let's go back up here. And I have leiomyomas listed in here. I started on that one. I didn't get as much information on that one, but I think I have two. I have uterine fibroids. I think I have 2 spots. Oh yeah, I do have uterine fibroids here. So this is where I put all my information on uterine fibroids. I had started one and then ended up doing a different one. The fibroids classes and submucosal, different types. GnRH agonists, how they're classified, and leuprolide acetate for treatment, medication management, for, like OCs, and what symptoms they'll have with leiomyomas, how to diagnose them. And yeah, so I have information on that. I added in breast cancer guidelines. I felt like this was really important too because I have, I felt like there was a lot of information, I guess, and really wanted to clarify that. So I wrote down the BI-RADS, how that mammogram report comes back. So I'd have that information, breast cancer, risk factors, for breast cancer, signs and symptoms, I think is really good to know because we do a lot of breast exams on annuals. Types of breast cancer, non-invasive, invasive lobular, invasive ductal carcinoma, and what symptoms you see with that, the survival rate, invasive breast cancer, let's see, compared to infiltrating ductal carcinoma, so comparing the different types, lobular carcinoma in situ, grade 1, grade 2, grade 3, ductal carcinoma in situ, how that presents, who's at risk, treatment for breast cancer, oncotype diagnosis, breast conserving therapy, mastectomy, therapy such as radiation, endocrine therapy, tamoxifen, and information on how that works, side effects, patient education, diagnosis of if they end up having bleeding when they're on tamoxifen and things you should do when that happens, endocrine therapy such as estrogen receptors, aromatase inhibitors, side effects, treatment, all the information, follow-up and survivor information, vasomotor symptoms that can be managed with SSRIs or SNRIs, arthralgia, how you can manage that, lymphedema, loss of bone density, physical or sexual dysfunction, screening and the role of the primary care nurse practitioner, and any worries the patient might have who's been diagnosed with breast cancer. Okay, and another one I have on here is ovarian cancer and endometrial cancer. Symptoms that are exhibited in patients who have ovarian cancer or could have it, diagnosis, information about grading and staging, and when to use the CA-125 for diagnosis, fallopian tube carcinoma, and then endometrial cancer causes, symptoms, pap smear findings, physical exam and diagnostic workup, adjuvant treatment for cancer, uterine sarcoma and the 4 subtypes, cervical cancer, risk factors, symptoms, diagnostic, treatment, surgery, radiation, follow-up, and then I added in a vulvar and vaginal cancer, risk factors, symptoms, diagnosis, treatment, vulvar cancer down here, same thing, risk factors, symptoms, diagnosis, surgery, treatment, and when to follow up, palliative care, and patient education on that one. Menopause, I also added information in here. And that's all that I have for today because I'm at the max limit. Thank you for watching.